Hey there, viewers! Cancer is scary and deadly if not diagnosed in time. According to a report, an estimated 1.8 million new cases of cancer will be diagnosed in the United States this year. It's important to get the right diagnosis in time, and for this, you need to be aware of early symptoms. In today's video, we'll be discussing 9 cancer symptoms that men shouldn't ignore. Are you having problems while peeing? Are you having difficulty swallowing? What about a bad fever? We're talking all that and more. Number 1. Pee problems. Do you pee more often than you did before, especially at night? Are you even leaking throughout the day? This urgent need to go will interfere with your life so much, you won't want to go somewhere unless you're sure there's a bathroom nearby. Even a slight burning sensation shouldn't be taken lightly. A weak stream should be another reason to talk to a doctor. Your doctor will examine you to see if there's an enlarged prostate. A blood test for prostate cancer could be recommended as well. The prostate is a walnut-shaped gland found in men. Its cancer is one of the most common types. The relieving part is several prostate cancers grow slowly and remain confined to the prostate gland. The bad news is that it can be a huge health concern if it's not detected in time. It is the second leading cause of cancer death for men in the United States. 1 in 35 men die from prostate cancer. Did you ever have a prostate exam? What was it like? Share your experience with the Bestie community in the comments below. Number 2. Blood in your stool or pee. This is one of the scariest things a person can experience. Whatever the problem is, it needs to be addressed sooner rather than later. Sounds a bit gross, right? Why would anyone check the color of their stool? But you should, and here's why. It's normal to experience changes in color due to the foods you eat. For instance, if you ate beetroot, expect to have a really red stool the next day. Certain diarrhea medications and iron supplements can make it look black. But that's about it. What about when you haven't been eating beets, iron supplements, or taking meds, yet your stool looks really different? This indicates that there is a problem and you need to consult a doctor. But a lot of people don't want to see a doctor. Don't do this. Sometimes these problems could have serious consequences. Your stool is black because of the presence of digested blood. This indicates bleeding in the upper gastrointestinal tract. Red stool means you have bleeding in the lower gastrointestinal tract. The pale kind means you have problems with your liver or bile ducts. You cannot ignore the color of your pee either. If you notice red-colored pee or streaks of blood, seek help. This could be a sign of a urinary tract infection, prostate problems, or kidney issues. Experts say blood in the urine is often the first sign of bladder cancer. Number 3. Changes in lymph nodes. There are small bean-shaped glands called lymph nodes in your body. You have these lymph nodes in your armpits, neck, around your gut, and other parts of the body. They exist to drain lymph fluids from nearby organs or areas of the body. Check your lymph nodes from time to time to see if there's any tenderness or swelling. Depending upon the site of the swollen lymph node, you could be facing serious health challenges. Certain types of cancer can trigger changes in the lymph nodes. When your immune system is fighting against a sore throat or cold, your lymph nodes can get tender. But if any of the changes persist for more than 2 weeks, you need to get them evaluated. Number 4. Changes in your skin. Do you pay attention to your skin beyond the daily cleaning and moisturizing? If you do not, it's time you make a bit of a habit to examine your skin. Look for old and new moles. See if there are any changes in the shape, size, or color of the mole. Are there new spots or just the old ones that look different? All of these could be signs of skin cancer. Depending on how the physical exam goes, you might be prescribed a biopsy. A small piece of tissue from your skin will be sent to a lab to rule out cancer. Can you do anything to reduce your risk of getting skin cancer? Definitely. Too much sun is one of the major risk factors for skin cancer. Ultraviolet light rays present in the sunlight can damage the DNA in your skin cells. Lights used in tanning beds also have harmful UV rays. Of course, there are other factors as well. For instance, a weak immune system and exposure to toxins can also cause skin cancer. Whatever the case, make sure you're doing your best to reduce the risks. Always wear a reliable sunscreen that protects your skin from harmful UV rays, and this means wearing sunscreen all year round, even during rainy days. Wear protective clothing if you'll be in the sun during the middle of the day. Number 5. Frequent heartburn. It's normal to get heartburn once in a while. It could be the greasy burger you ate or the leftover pasta from last night. But if you experience heartburn frequently, don't brush it off. Do you get heartburn so much that you worry about it while eating? You could have acid reflux. Acid reflux means your stomach acid flows back up your food pipe. You need to get treatment for this. If you don't, the corrosive stomach acid will harm the tissues of your food pipe, leading to an ulcer. Though rare, chronic acid reflux can cause cancer of the food pipe. Before we move ahead, here's another video you might like. Watch out for 10 body changes that need immediate attention. Number 6. Problems with swallowing. Do you find it hard to swallow? Some people do from time to time, but if it's been quite some time and you're still having problems, things could be serious. Especially if you're also losing weight or vomiting. This is a sign that something is wrong with your throat or food pipe, maybe even both. But what causes it? Inflammation of your food pipe, brain stroke, spinal injury, or problems with your nervous system. Anything can cause you to have swallowing troubles. There could also be something blocking your food pipe, like a tumor for instance. It can even be throat or stomach cancer. Number 7. Mouth changes. Do you smoke or chew tobacco? Then you need to be aware of this. Watch out for all changes in your mouth. You could have lumps on your gums. Swelling of the tongue shouldn't be ignored either. Look out for yellow, red, white, or gray patches in your mouth. All of these could be signs of mouth cancer. In case you have canker sores or ulcers with a crater that do not heal, book an appointment with your doctor. Do not keep self-medicating. Smoking and chewing tobacco puts you at higher risk of getting cancer. More than 60% of mouth cancers are linked to smoking. Number 8. Unexplained changes in your weight. Are your clothes a little loose these days? Have you lost weight without trying to? Have you gained weight despite your healthy diet and workout routine? Unexpected weight changes shouldn't be taken lightly. It's a sign your body is struggling with something that's making you gain or lose weight. Stress or thyroid problems could be responsible for these changes. If you've lost 10 pounds or more, you need to be vigilant. It can be a sign of cancer of the lungs, pancreas, or stomach. Number 9. Fever. Usually, fever isn't a bad thing. It means your body is trying to fight an infection. But it is a concern if your fever doesn't go away, or it keeps coming and going without any explanation. It could be a sign of cancer, especially blood cancer. Cancer is scary, and the majority of the time it seems to come out of nowhere. As experts say, cancer awareness and early detection are the best ways to fight it. And the good thing is that you can do both by learning more about cancer. Here's how. You can watch 12 cancer-causing foods you should not eat, and women especially need to watch out for these 12 signs of cancer most ignored by women. Go ahead and click one. Learn more about cancer. Also, don't forget to like and subscribe to our channel. Do you self-examine yourself for any of these cancer signs? Let us know in the comments below.